Welcome to MindRay Patient Monitor Application Guidance. This module is a guidance of the application of the HemoSight Clinical Assistive application, through which you can easily evaluate and review the hemodynamic status of the patient. The HemoSight function will be available when you are using one of the cardiac output monitoring modules. Enter the main menu. Select HemoSight in the CAA column to access it. There are four main functions of HemoSight: diagnosis, test, follow-up, and evaluation. In the diagnosis page, you can have a comprehensive view of all related hemodynamic parameters, covering cardiac output, contractility, preload, afterload, organ function, and oxygenation. Different cardiac output monitoring modules provide different parameters. This is a demo with PICO and SCV-O2 modules, which can provide the most comprehensive information in the HemoSight. The normal ranges are presented beside the parameter values as references. Besides, an up or down arrow helps intuitively indicate whether the parameter value exceeds its limit. The physiological graphic displays monitored parameters using animation, which gives a visual representation of the interactions between the heart, lung, and vascular system. During diastole, the dotted line marks the normal end diastolic volume status. The heart size in diastole indicates the preload status. During the systole, the dotted line marks the normal ejection fraction status. The heart size in systole indicates the cardiac contractility status. The afterload is indicated by the blood vessel diameter, which represents the systemic vascular resistance status. When the extravascular lung water measurement is available, the status of lung water is being represented. The ELWI is considered too high if the liquid level exceeds the dotted line. When SpO2, SCV-O2, or SvO2 is measured, there will be corresponding changes in blood color according to the variation of SpO2, SCV-O2, or SvO2 values. The physiology relationship screen depicts the balance between oxygen delivery, DO2, and estimated oxygen consumption, VO2. The connecting lines highlight the relationship between each parameter, thus helping healthcare professionals quickly locate the root causes of hemodynamic abnormalities. A star symbol indicates that the parameter is based on intermittent measurement. For example, GEDI and ELWI are measured from the transpulmonary thermodilution, which are not continuous variables. Two-star symbol indicates that the parameter is input manually. For example, the hemoglobin level. Other parameters are real-timely updated. A solid line means that parameters connected have a direct relationship. For example, the continuous cardiac index is directly determined by two factors: the heart rate and the stroke volume index. However, the dotted line means that the parameters connected have just an indirect relationship. The decision model is a reference for clinicians' therapeutic decisions. After analyzing the current physiological status, the highlighted route provides target values of related parameters. The decision model is integrated from Pulsion Medical Systems, so it is only available when using the PICO module. The test page provides the physiological parameter trends before, during, and after a hemodynamic test, helping evaluate the fluid responsiveness of the patient. PLR, passive leg raising, or RFL, rapid fluid loading, is a test that predicts whether the cardiac output will increase with volume expansion in acute circulatory failure. During the test, the short-term and transient changes of relevant physiological indexes must be closely monitored and tracked to evaluate the effects of increased venous return. To perform the test, a test duration should be selected first. After pressing the Start button, a test will go on. The trend will be tracked, and the current value, reference value, deviation of each index will be intuitively displayed to help assess the effects. Those indexes are also available to be selected and customized in each specific case. The follow-up page displays the cardiac function curve, lung water curve, and SVV/PPV slope indicator. The shaded areas in the cardiac function curve and the lung water curve indicate the normal range of x-axis and y-axis parameters. The SVV/PPV slope indicator is a numeric representation of the cardiac function curve, which is used to assess the fluid responsiveness. The value, position, and corresponding color of the dot on the SVV/PPV slope can be easily interpreted. When SVV/PPV less than and equal to 10%, the dot will be green and may predict the patient is fluid unresponsive. When SVV/PPV is greater than 10%, the dot will be red and may predict the patient is fluid responsive. Please be noted that PPV and SVV are only applicable on mechanically ventilated patients with sinus rhythm. The hemodynamic parameter changes can be reviewed on the evaluation page. The changes are displayed by conventional trends and also an intuitive spider vision diagram. The spider vision diagram enables clinicians to simultaneously monitor different hemodynamic parameters to see if they are outside the target ranges. Each spider leg is divided into 3 segments, indicating different value ranges for the respective parameter. The outer segment will be highlighted when the corresponding parameter value exceeds the upper limit. The inner segment will be highlighted when its corresponding parameter value exceeds the lower limit. The middle segment indicates the parameter is within the normal range. The structure of the spider vision can be customized in the setup, and the parameter for each leg can be selected accordingly. This is the end of HemoSight application guide for Mindray patient monitors. Thanks for watching.